Hello, welcome to our info session. This is recorded so that we can share out with other folks that aren't able to attend live, but thank you so much for coming. I'll just get started with some introductions, logistics, and then pass it off to Mikelle McCoin. So I am Jay Sevilla. I advise for nutritional science majors here in Rouser College. Um, and I'm here to just run the logistics of this presentation. So send any of your, oh, I should just disable the waiting room. Let me do that. There we go. Great. Um, so send any of your questions into the chat, or you can send them directly to me. There's also the Q&A function, many different ways that you can submit your questions. I'll field all of those questions for Mikelle at the very end. She'll go through a presentation. We'll go through any questions and responses, and then that'll be our time together. But without further ado, I'll go ahead and pass it off to Mikelle.
All right, thank you so much, Jay, and thank you for being here today to learn about the career path of registered dietitians. My plan for today is to talk about what registered dietitians do and what the opportunities are for registered dietitians, how you can go about becoming credentialed as a practitioner, and then talk about our program here at Berkeley, the Master of Nutritional Sciences and Dietetics graduate program in the Department of Nutritional Sciences and Toxicology. So again, my name is Mikelle McCoin, and I am the program director for the Master of Nutritional Sciences and Dietetics program at UC Berkeley. And I was the undergraduate program director for our didactic program in dietetics for a good number of years before we phased that out and moved into this graduate program. So here we go. Got to figure out how to move the slides. All right, there we go. So hopefully you're here today because you already know what registered dietitians do and what they are, but I want to provide you a little bit of background in case this is something that is new to you. So registered dietitians are also called registered dietitian nutritionists. So these are synonymous terms, and dietitians can, or they're also called dietitians. So dietitians can either go with the credential of RD or RDN, and they're interchangeable. And registered dietitians are food and nutrition experts who provide evidence-based advice to improve health and well-being for individuals. We are healthcare providers, recognized healthcare providers, and part of the healthcare team. And many dietitians work along the healthcare team in the inpatient and outpatient setting. But we also work in various other settings as well. Everything from corporate wellness and sports nutrition to pediatrics and community nutrition programs. Basically, I like to say anywhere where you find food, you can find a registered dietitian. And many registered dietitians are entrepreneurs also, and they are consultants and they work in, business or private practice or consult with different companies as well. So there's really sky's the limit. It truly is the credential that gives you the credibility to talk about food and nutrition, because we do have the credential RD or RDN, which brings me to the next point. Registered dietitians are different from nutritionists. So nutritionist is not an accredited term. It's not a regulated term. There's no required education to call oneself a nutritionist. So that is how we are different from nutritionists, because we do have accredited coursework and supervised practice and requirements to earn the registered dietitian credential. So only registered dietitians can call themselves registered dietitians. They can also call themselves nutritionists, but nutritionists can't call themselves registered dietitians. And as I mentioned, the credential is an RD or RDN. So, just to dive a little bit deeper, what do registered dietitians do in their daily lives when working in this area? One thing that we uniquely do is assess individual nutritional needs. So, rather than just providing general nutrition education and health information, we look at individuals and what their nutritional needs are based upon their personal factors, social factors, medical conditions, medications that they're taking, and so on, their physical activity, their age, etc. So we really, determine what their nutritional needs are. And then we look to see if their diets are matching their nutritional needs and how we can help them make changes to their diets to meet their nutritional needs. So we develop nutritional care plans for individuals. So whether this is in the hospital or the outpatient setting or even in the group setting, thinking about at schools, we're, putting together meal plans for children of similar age groups. So you could be, providing meals that way, or even in hospitals, putting together meal plans for groups of individuals. We provide a lot of nutrition education and counseling. So the goal always is for people to, live independently and to be eating foods that meet their nutritional needs. So we're working with clients on healthy eating and disease prevention and medical nutrition therapy, which is considered a medical treatment. Is providing nutritional care to really minimize the complications of diseases, ideally prevent diseases, prevent any worsening of diseases. And that's one thing that registered dietitians do uniquely different from other, nutrition educators is we provide this medical nutrition therapy. And that's actually a reimbursable treatment from insurance for some conditions. So we spend a lot of time, like I said, educating and counseling. So if you really like working with people and you want to improve health, it's a great profession for that because we do a lot of talking with individuals to see how we can personalize diet plans and their food choices to meet, again, their nutritional needs. Mentioned already, we collaborate with healthcare teams. So we work right alongside doctors and nurses and other healthcare professionals in the hospital. We do medical rounds with the team, assessing patients and providing our input on the patient's nutritional status so that we can prevent malnutrition and help our patients get home sooner and have increased healing and recovery and quality of life. Many dietitians also conduct research. We need lots of research on nutrition to see what our most effective strategies and interventions are, and also education as well in community nutrition programs. So many dietitians work in community programs where maybe we're not experiencing, any disease yet, but we're really trying to prevent disease and keep our communities healthy. And so they're working in these community programs providing education. So I've already sort of mentioned where dietitians work, but this slide shows it again. The majority of dietitians work in clinical care. And so that's these first two boxes. 24% of dietitians work in hospitals, and they provide acute medical nutrition therapy care to their patients that are in the hospital. 24% of dietitians work in the outpatient setting or in ambulatory care, where patients will go, just like you might go to a doctor in the outpatient setting. Patients come see the dietitian in that outpatient setting, and we have one-on-one visits to strategize about their nutritional needs and how to help improve their nutritional status. 8% of dietitians work in public health and community programs. So many of these are federally funded programs, the Women, Infant, and Children Program, Supplemental Nutrition Assistance Program, and other nutrition programs that are out there. 3% work in schools. So kindergarten through 12th grade provide breakfast and lunch, to all of the school-age children. So many dietitians are the food service directors of these school districts, and they get to oversee the National Lunch Program and the nutrition standards and make sure that their menus are meeting the standards set forth by the government. 6% of dietitians work in long-term care. So these would be facilities where people are recovering from illness or perhaps staying till the end of life. And here, dietitians, you can imagine, it would be very important to maintain one's nutritional status. And so dietitians are seeing the same clients for an extended period of time in this long-term care. So it is, inpatient, but an extended care environment. 6% of dietitians work in private practice where they have their own business and they're working still alongside the healthcare team. I always like to point that out. It's always really good to receive referrals from doctors, communicate your plans back to the healthcare team so that we're all working together. But they see patients in their own business that they perhaps have developed in doing other types of consulting. And 6% of dietitians work in research and education. So we do every couple years, our professional organization surveys registered dietitians to see how much money they're making and what they're doing. And so I think that's always important to consider when you're thinking about looking at jobs. And so this was published, I think, in 2023. Or 2024. But the average salary nationwide, the median salary was $80,000 per year. So half make below and half make above. There are many factors that impact salary, of course, the biggest one being experience. The longer you're in a position, the higher your salary is going to be. In addition, how many employees do you supervise? The more responsibility you take on, the higher the pay. Similarly, the budget. What size budget are you overseeing and what's your responsibility there? And then different practice areas pay more. Management, research, education, and consulting all pay at a higher rate. And then also where you're located in the United States. So here on the Pacific side, the median salary is actually $96,000 per year, half below, half above. So that is quite different from other parts of the United States. It is projected that there's going to be a high demand for dietitians in the future, a projected 7% increase over the next 10 years, which is faster than the average projected job growth for all industries looking across the board. So there is a demand for that because we have an aging population and more people are interested in health and wellness and nutrition. And 84% of dietitians report that their primary position is full-time. Many dietitians start in a variety of part-time positions. Hospitals usually hire dietitians as per diem, which means as needed. And so they come on part-time, they cover different shifts, and then as a full-time position becomes available, they're already trained and ready to start working. But 84% are reporting that they are working full-time. So why might you want to become a dietitian? I mentioned the strong job outlook. There's diverse career paths. Many dietitians that I speak with, what they love about it is that they can do so many different things. They can work in school nutrition, clinical, they can do some counseling. They might have a little private practice where they see a couple patients a week. They might consult with a food company. They might try something out and then pivot and do something else. So as I mentioned, if there's food, there can be a registered dietitian. So they just love the flexibility. They also just love all the different ways that they can practice being a registered dietitian. And they really like to dabble in all of these different careers, which is pretty fun. Also, what I hear from dietitians, and a big reason why people go into it is that you really feel like you're making an impact on people's lives. And so if you like helping individuals and you want to see them achieve their health goals, it's a great profession for that. It is so rewarding to work with a client and help them realize their goals. And when they start implementing, what you've been educating and working with them on, it's just very rewarding to see how that impacts their lives and how wonderful they feel. And also there's a lot of flexibility in this position as well, similar to diverse career paths, but you can work in a lot of different ways. You can work, full-time in a hospital. There's a lot of remote work, consultant work where you can, develop your own schedule and have some flexibility there, too. So those are some reasons why you might want to become a dietitian. So how do you become a dietitian? So this is 6 steps to maintaining, from starting to maintaining your credential for. So the first step is that you need to, well, have a bachelor's degree, but then you have to have a master's degree. So the master's degree requirement came into effect January 1st, 2024. So you can no longer become a new registered dietitian unless you have a master's degree. It can be a master's degree in anything, but you do have to hold a master's degree. So the second step is that you need the accredited coursework. So to become a registered dietitian, again, this is a recognized credential, and to have that, we have to prove to the Department of Education that we are teaching a certain curriculum. And so that is our accrediting agency comes into play there to make sure that we are teaching the appropriate curriculum. So you can get this accredited coursework through a few different ways. So one is an undergraduate didactic program in dietetics. So UC Berkeley no longer has an accredited undergraduate didactic program in dietetics. So that is not available at UC Berkeley. But you can also get the accredited coursework through a coordinated program. So coordinated means that there is the accredited coursework and there's step 3, which is supervised practice. And going back to step 2, you can also get the accredited coursework through what our accrediting agency calls graduate programs. So just a general term called graduate programs. And graduate programs also combine the accredited coursework and the supervised practice, which is step 3. So coordinated programs and graduate programs, the one way in which they may differ is that some coordinated programs can actually be at the undergraduate level, but there are definitely coordinated programs at the graduate level too. And since you need step 1, which is a master's degree, it'd make the most sense to complete a coordinated program at the graduate level or a graduate program, which is obviously at the graduate program as well. Looking at that didactic undergraduate program, there could be the possibility that you could find a 4-year school that offers the didactic courses at that undergraduate level, and you could just take those classes and not earn a degree and just earn that coursework. But it doesn't make a lot of sense because, again, you need step 1, which is a master's degree. So most likely that wouldn't be the path for you to just go get the coursework completed at a different undergraduate university. Okay, so you need a master's degree. Step 2 is you need the coursework. So I've described 3 different ways that you can obtain the coursework. And then step 3 is you need to complete an accredited supervised practice experience or internship or rotations. So just like step 2 and step 3 are both accredited. And so you can't just go find like your own experience and suggest that might be fulfill the requirements to become a registered dietitian. So it has to be an accredited program. So those types of programs, there's something called a dietetic internship. That would be a standalone program that offers supervised practice. But then there's also the coordinated programs and the graduate programs. So that would be the same as step 2. So step 2 and step 3, if you entered a coordinated program or a graduate program, you get the coursework and the supervised practice. And if you do the coordinated program at the graduate level, you're also earning step 1. So back to step 3, that dietetic internship, you would only be eligible for a standalone dietetic internship if you completed step 1, you have a master's degree, you completed step 2, you completed the didactic undergraduate coursework somewhere, and then you could apply to a standalone dietetic internship. So assuming, you're all UC Berkeley students, that those steps they're not the most efficient, I guess I should say. And the most efficient way for you to become a registered dietitian is to do the coordinated graduate program or a graduate program, because those will all provide step 1, 2, and 3. So after you graduate, this is really important, you still have to pass a national exam. So the Commission on Dietetic Registration exam is like a whole other part of your education, and students report studying for 1 to 3 months for this exam. So you need to pass that. And then step 5 is if you live in a state that requires licensure, you have to apply for a license to practice as a registered dietitian. It's usually a pretty low fee to do that. California does not require licensing, but 48 states do. California is working on licensure, and we want to be licensed, but it hasn't been that easy to obtain at the state level. It does require passing of a law to become licensed. And so we're not licensed yet, but we're hopeful. And step 6 is you have to maintain your certification. So every 5 years, you need to complete continuing education, 75 hours in 5 years, and submit that to the Commission on Dietetic Registration, who oversees our credential. So I'm going to go back to these programs, coordinated programs and graduate programs, and that's what this next slide is. So you might wonder, how do you find these types of programs? And this is a really important website. It's at eatrightpro.org. I'm not going to spell it all out, but if you Google Eat Right Program Directory, you will likely find this hyperlink. And this is a directory of all the accredited programs out there. Because remember, you need an accredited program. And so you can search in the program what you are looking for. So you can put the state and then the program type. And unfortunately, this is just a snapshot, so I can't show you, but you would click the down arrow and you can click, you will see on there coordinated program and graduate programs. So that's all you have to do is search for graduate programs or coordinated programs. I did mention that coordinated programs could be at the undergraduate level. So you could click over on the right-hand side and also click this box that says master's degree. So if you were going to search for a coordinated program, you might want to click master's degree to make sure it's a master's level coordinated program. So hopefully that's all really I need to show on this slide. But it is important to know that all programs are different. So they're very similar because there's accredited coursework and accredited supervised practice, but there's many ways to meet the competencies and standards that our accrediting agency puts forward. So every program is going to do this in a slightly different way. So it's really important to read about different programs to see what they offer to make sure that it matches your interests. And also every program has different prerequisites and requirements for entry. I would say they're very similar, but there might be slight differences. And the only way to know what any program requires is to go to this program directory, find the program, and then every program will have its program page hyperlinked. And so you can click on that and you should be able to find the information about the prerequisite requirements to enter their programs. So there is some work involved. You can find the programs here, but you have to click on the program to learn about it to see what they offer. So hopefully that is all clear, and I'm now going to move into speaking about the program here at Berkeley that we have. We are entering our, we just admitted our 3rd cohort. So we're entering our 3rd year in the fall. So we're a pretty new program. But it's been wonderful, and we're just really excited to have this on campus. So it's a Master of Nutritional Sciences and Dietetics. It is a graduate program. So as I mentioned, that's like an umbrella term. It's actually not umbrella. It's a specific program type. It's not very specific, I guess I should say, but it is considered a graduate program. They used to be called future education model programs. So you may have seen that if you've been researching this career path for a while, but that term future education model program is being phased out and replaced with graduate program. So a few highlights about our program. So again, graduate program, that means we have both the coursework and the internship hours in this one comprehensive program. It's also integrated, and that means that all of the semesters, except for one, we have both coursework and internship hours happening at the same time. So students are on campus taking class, and then they go off campus to professional work sites and they train under a registered dietitian nutritionist to really see that practical side of practice. So we are a professional graduate program. We are training you to be a profession for a profession. Sorry, we're training you for a profession and to be a professional registered dietitian. So the professional graduate programs have different degree designations, and our degree designation is MNSD, so a Master of Nutritional Sciences and Dietetics. So students that graduate from our program would earn the designation of MNSD, so a Master of Nutritional Sciences and Dietetics, and then RDN. So those would be their credentials after their name. Our program is general enough for all interests, but we definitely have more of a focus on clinical nutrition and research as well. So general enough in the sense that we, again, being that we're accredited, we have to provide education in all the competencies. So students that are interested in foods and food systems management, like they will definitely have access to that and get the education that they need in that arena, and same with community nutrition and public health. But the most of our courses and time is spent focusing on clinical dietetics and research. So we have a research methods class, and then we integrate research principles in all of our courses. And then over the summer, between year 1 and year 2, students do a 10-week research project. And that is their capstone requirement for earning a master's degree at UC Berkeley. So the students get to engage in research that way. And in terms of clinical dietetics, we have a course in clinical dietetics the first semester and the second semester. And then even in that next year, the third semester, we have a course focused on counseling, which falls in line with clinical dietetics. And students spend 16 weeks in a hospital studying and learning how to be an inpatient clinical dietitian. So that's our longest rotation, is 16 weeks in that inpatient side. And then students spend 5 additional weeks in the outpatient clinical side. So in all, that's 21 weeks of clinical dietetics supervised practice, which is a little bit higher than some other programs that have a focus area maybe of community nutrition, where they might spend more like 8 to 10 weeks in a community program, or even programs that are more focused on food service management would have a longer rotation in that area. Our community nutrition rotation is 5 weeks, and our food service management rotation is 7 weeks. So those are shorter, showing how this is a clinically focused program. One really great thing about our program is that we have found all of the supervised practice rotations and facilities for our students. So as you research different programs, you might find that some of them say, you have to find your own internship or your own supervised practice rotations. And that can be really challenging for a student if you're not familiar with the area, or you don't, have a strong network of dietitians. So we have activated our Bay Area community, and we have wonderful hospitals and community programs and schools, all, lined up for our students for this supervised practice experience. We also have identified all of the research opportunities for our students over this summer experience. The program is very fast. That's the next point. It's 21 months. So it's an academic year plus the summer, and then the second academic year. And all 21 months are really accelerated and full, because we are getting you the coursework, the supervised practice, and research all in this time period. So this is why we also identified the research opportunities for our students, because there's just not enough time for students to explore and try to figure that out themselves. But of course, if a student had their own idea for a research opportunity, we would, see if we can make that possible for them. One thing that also makes our program unique is that we have enrichment opportunities. So almost every week, we're bringing in outside speakers to talk about their area of expertise. We go on field trips. We have a lot of socials for our students. We also do some rotations on campus. We work with Cal Athletics, the University Health Services dietitians, the Basic Needs Center, RSF. I think that's what it's called, the gym. So we're doing fun stuff with our campus partners, the Berkeley Food Institute. So we really try to get our students, immersed in campus and do education that way, and provide education back to the undergraduate students, which is super fun. All of our faculty are registered dietitians for the most part, I should say. And so students are paired with registered dietitian faculty mentors so that, we've all been through it. We all practice as dietitians. And so we can really mentor our students and kind of launch them into the career. We have other wonderful faculty that are more focused on research. They're not necessarily registered dietitians, but they support the research side of the program, which is phenomenal. We admit 20 to 22 students per year, so we have nice small class sizes. Students take all of their classes together, so they really get to know each other and they're one another's support system as they, go through their supervised practice, and then also as they, graduate and enter their careers. And then, of course, where we're located, San Francisco, beautiful Bay Area. We have a brand new teaching kitchen. That's this first picture up here. And it's in the Anchor House housing area. If you guys have been there yet, you should go check it out if you haven't been there. This is a picture of our students presenting a poster from their research this summer. And then this was a field trip that our students took. So I've already mentioned, I think everything on this slide is 21 months. There's research that summer between year 1 and year 2. We integrate that supervised practice. It starts in year 1. Year 1 is primarily coursework with just a little bit of supervised practice, and year 2 is primarily supervised practice with just a little bit of coursework. So that's how we progress in the program. So the admission requirements, these will be similar to other programs, but again, if you're, researching other programs, you should definitely go to their website and see what their admission requirements are. There's always going to be a list of prerequisite courses. That's my next slide. I will go to that. At Berkeley, there's a minimum requirement of a 3.0 advanced GPA. That's your last 2 years of your undergraduate education. Most schools have some type of GPA requirement. Most programs are looking for some type of experience, volunteer, work experience, research experience, something that's taking you outside of the classroom. We especially like to see students that really want to become registered dietitians. Our entire program is about preparing you for the profession. And so if you have experience in an environment where registered dietitians work, that really signifies to us that you know what dietitians do and you really want to pursue this career path. We're looking for students that have strong letters of recommendation. So think about who's writing a letter for you. Do they know you well? Can they, speak to your qualities and why you're going to succeed in a graduate program? We read these essays pretty, carefully to, again, see, are you interested in becoming a dietitian? What do you know about dietetics? Where do you want to take your credential after graduation? And then we have an interview also. And so we want to see that you're professional and you can, speak about dietetics and about your experiences and really demonstrate your strengths and why you'll succeed in the program. So going back to the prerequisite courses, this is our list of prerequisite courses, which is the Nutrition and Metabolic Biology major or Physiology and Metabolism major of Nutritional Sciences, of the Nutritional Sciences major, all these majors. So, if you're, in that major, you will have the prerequisites, except for the microbiology. That's an optional upper division bio elective. And so you would want to opt to take microbiology. But otherwise, you would meet all of the requirements through that major. And other programs would have very, very similar prerequisite requirement. So if you're coming in from a different major, you still can be qualified. You just need to make sure you take these types of prerequisite courses. So again, our accrediting agency requires a foundation in science. This is a science. You're a healthcare provider. You're looking at labs and medicine. And so it's really important to have a strong foundation in science. And so these are the usual prerequisite requirements. Our program does require 2 additional foundation science courses, which again are physiology, metabolism major meets through, I believe you take Organic 1 and Organic 2. And then you take Gen Chem 1 and Gen Chem 2 also, right? I think so. So we can check on that in a minute, but definitely you definitely meet these, or biology, you take bio 1. So maybe it's Gen Chem 1 and Organic 1 and 2. But not every program requires these 2 additional foundational science courses. So we have found that students coming from other universities sometimes have to take an extra semester of organic chemistry or general chemistry before they enter our program. So if you are coming in from a different major, you might not need these additional foundational science courses, if that makes sense. We do require the laboratories that come with all of this. Many schools do as well. And then we require a nutrient metabolism course and the metabolic basis of human health and disease. Our program was, designed with our undergraduate program, in mind, and what our students had already been succeeding in dietetics with, because we did have this undergraduate program in dietetics for a long time. Program fees, it's important to know that because this is a professional graduate program, the fees are higher than state tuition. And this is the case for many, many dietetic programs across the nation. Many of them are at the graduate level, and there'll be different fees. So we do charge by the unit. So it's $992 per unit, and the degree requires 66 units. So you definitely should, do some math and learn about the fees of these types of programs. And then, of course, there's housing and whatnot. And I circled travel here because our students, just like any program, have to travel to supervised practice sites. So maybe try traveling to San Francisco or down to Fremont or, further east. And so there are transportation costs that you need to consider because we do not have everything right in Berkeley. In terms of financing, graduate programs, students are eligible for loans. There are not federal grants for master's students and likely PhD students either, but there are federal loans. There are some scholarships, not federal, grants, but there are scholarships available for programs. There's employment as well, so graduate student instructor appointments. And then many graduate students lower their tuition because they come in with their own health insurance. So they can save about $6,000 per year if they can prove that they have their own health insurance and they do not have the health insurance provided by the university. So in terms of applying, applications open mid-September. So for other programs, they likely open about the same time. You might, about mid-September. All programs this year going forward have to use a centralized application system. So you will find all programs on what we call DICAS, the Dietetic Internship Centralized Application System, DICAS. And all programs must inform students by the same date. So students have all the information they need to make decisions. And that date this year was March 1st. And then students are actually required to decide by March 15th. So these are some new policies that have been put in place over the last couple years to make sure that all programs are working in the same way so students can make the most informed decisions that they can. I also want to acknowledge that the School of Public Health has a dietetic internship, a standalone dietetic internship. And so to be eligible for that program, you have to come in with the undergraduate coursework in that, in the dietetics, the dietetics undergraduate coursework. So, if you're currently matriculating at Berkeley, we don't offer that. But, if you did want to find that undergraduate coursework at a different university and complete it, you could enter the School of Public Health, earn a master's in public health, and do their dietetic internship, their standalone dietetic internship. So that is another option on campus, but it's different from ours, and it's a viable path if you have that accredited undergraduate coursework. So here are some student quotes that are cut off and you can't read, so that's not helpful, but at least you can see some of our students, which is great. So I won't try to read those, but I do see there's a lot of chat questions going on, so I think we should go ahead and open that up. So Jay, do you want to ask the questions, or do you want me to open up the chat?
Yeah, I can review the questions. I've been keeping track of them in order. We have about 14 minutes left as well, just for a time check. Before we get into the questions, I definitely wanted to briefly touch on the prerequisites that you had mentioned, Mikelle. So yes, for anyone and most of you I recognize in here, so I believe that most of you, if not all of you, are nutritional science majors. So for those of you that are doing the NMB, Nutrition Metabolic Biology major, formerly known as Nutritional Science Physiology Metabolism, NSPM, the chemistry requirements, the biology requirements, plus the lab requirements, all of these will be met because part of your major requirements are to take 1 semester of general chemistry, 2 semesters of organic chemistry, Bio 1A, and then MCB 32 physiology, and then all the respective labs. So that totals to 5 labs. So all of that will be met with your major requirements as a nutritional science major. And then I put in
Except the microbiology.
yes,
So
except the microbiology.
yeah.
Yes, so
And you
that
should,
one.
any program is going to require microbiology. So
Good to know.
yeah.
Yes. And then in the chat, I put in, here at UC Berkeley, microbiology would be Public Health 162A, which is offered fall and summer. And as Mikelle mentioned, for the nutritional science majors, this would count towards your upper division biology elective. Students can try to take MCB C112, but this is tightly reserved for MCB and MB students. So if you're not able to get into the very small amount of unreserved seats that they have, most nutritional science students will take Public Health 162A for that prerequisite. So all of these links, the accreditation program, or Accreditation Association, Berkeley's program, and the prerequisites, all of these are linked into the chat. So to go over questions, the first question I saw, is accredited coursework after a master's degree, or is it the prerequisite for the master's?
Yeah, so it could be either. So if you can find it at the undergrad level, you can take it before you enter a master's degree. But it's just not an efficient way for any of you to do this. So the most efficient way would be to enter a graduate program that has the coursework. So it would not be a prerequisite, it actually is the program. So the graduate program has that accredited coursework. The coordinated programs at the graduate level have that accredited coursework. So the prerequisites are listed on this screen, and the accredited coursework is not a prerequisite unless you went this less efficient way that I'm not going to really describe again.
Thank you for that. The next question. I have my bachelor's degree in Cog Sci, but I'm interested in getting my master's in nutrition. So I don't have some of the prereqs to get the master's. Would you recommend taking these at a community college beforehand, or is there a simpler route?
Yeah, so that's a great question. We have a lot of students in that situation, and they take these courses at a community college for the most part. You can also take them at an extension program like UC Berkeley Extension, or UC Santa Barbara Extension. All of our UC schools have these extension programs where you can find these courses. They need to be taken at an accredited university. And so that would be the community college or a 4-year school.
Awesome, thank you. Similar to that, would exam credit like AP, IB, A-level exam satisfy any of the prerequisites?
Yeah, so we definitely will accept like one of our prerequisites if it's an AP course, but we don't want to see the majority of the courses AP. And if it was two, I mean, our preference is for one or less. But yeah, it doesn't mean it would exclude you if you took more, but we do want to see that you've taken these more recently and in that 4-year school or community college school.
Awesome, thank you. The next question, I believe this is specifically for Berkeley's program. What does the acceptance rate look like?
So, well, we're just kind of entering our 3rd year. So, do I have to answer that question? We get about 100 applicants, which is great. And then we end up with, yeah, a cohort of 22. I'll say we interview about 60 students. And so from 60, we end up with 22. Not everybody says yes, and so we do accept students from the wait list every year. So.
Oh, thank you. The next question, and if anyone wants to ask their question live, just raise your hand and I'll try to get things in order. The next question, how common is it for RDs to work in, don't know what this acronym stands for, FQHCs?
That is that like urban areas where like healthcare centers, somebody's gonna have to clarify before I can look it up. And just going back to that admission rate, the reason I don't want to say it is just because we're so new. Like we don't really have a good historical track of what our acceptance rate is yet. So I wouldn't want to like quote anything that doesn't have strong data behind it yet. We're still too new.
Yes, very reasonable.
Thank you.
All right, let's see if Trevor can clarify. Oh, sorry, federally qualified health centers. Okay.
Yeah. Give me an example. I'm sure
Oh.
they do. I'm sure they do.
Hi, sorry. Can you hear me?
Yes.
Okay. Um, I think maybe in one of the first slides it might have been mentioned about where RDs are able to work. I was just wanted to clarify to see if like that was possible because I know FQHCs are like able to provide healthcare to anybody regardless if they have any insurance and stuff like that. That's something that I'm interested in. So I was wondering if there was any opportunities for RDs to kind of like be part of that as well.
Yeah, like Medicare, like more Medicaid funded facilities. So that would be like a county hospital. And so dietitians are definitely there. So any hospital is going to have a registered dietitian in it.
Got it. Thank you.
Mhm.
Thank you. Next question. Great. Love that there's so many questions, y'all. Let me just read through it. Okay. So if a GPA is just below the minimum, could an applicant still be considered with the other, requirements, sufficient experience, letters of recommendation?
Yeah, they can. And also just, again, it's the advanced GPA. So it's the last 2 years of your undergraduate education. It's not your cumulative GPA. So consider that. But yes, there is an exception that can be made if all other elements are, exceptional and wonderful.
All right. We have about 6 minutes left, everyone. Any final questions? Oh,
I have another question.
oh yeah.
Sorry if you already said it. I think where I was a little bit loud, but for I asked this question in the chat, or I said the psychology, sociology, and anthropology requirement. You said that it was satisfied by the NutriSci, either metabolic biology or physiology and metabolism. Can you explain how that works again?
Oh, sure. So for this major, there's a breadth requirement of 14 units that are just basically not STEM courses. So you can easily satisfy the dietetics prerequisite of having psychology, anthropology, sociology coursework if you take a psychology, sociology course, and then it's also going to satisfy the breadth requirement or help satisfy the breadth requirement for the major. So that's more of what I was trying to allude to.
Do they have to be specifically anthropology, sociology, or psychology courses? Like titled that, or is it somewhere in the social sciences realm?
Yeah, somewhere in there.
That
Uh,
makes sense. That makes sense.
yeah, I mean, we prefer psychology because that's such an important part of nutrition and behavior change and understanding people. But sociology and anthropology and understanding groups and how they work is really important also. But then sure, the psychology of happiness is important. So kind of anything in there, but I guess our preference would be more of that introduction to one of these courses. So you can have that strong foundation in these disciplines.
Thank you. We probably have time for one more question if anybody wants to come off of mute or put it in the chat. And then and people are either stewing or preparing that question, Mikelle, is there a contact for anybody that has questions? And will we be able to receive this presentation for anyone that wants to review it?
Yeah, so it's being recorded. So happy to put that out there and give you the slides as well. And then our contact is dietetics@berkeley.edu, and it's on our webpage also. But yeah, DIETETICS, not always the easiest word to spell, dietetics@berkeley.edu.
Great, thank you. And that is in the chat. And yes, as Mikelle said, this is recorded. We will need to have our office transcribe it first before we can post it live or post it for people to view. But once that does happen, just look out for communications from our Office of Instruction and Student Affairs email to see when that recording is uploaded. And you can always just check our YouTube page as well, which I can look up in the next 3 minutes. Doesn't look like we have any other questions or thoughts yet, but if anyone does want to use our last 3 minutes, feel free to come off mute or send something in the chat. For YouTube account.
I have one question.
Yeah.
Real quick. I was wondering if there is kind of like a soft requirement for shadowing hours, or if there's a preference for people who have shadowed RDs before, and if so, if you know of any opportunities or best practices to try and get some shadowing with
Yeah.
RDs in the area.
So, we are looking for students that know what registered dietitians do. And so if you have that shadowing experience, you can really speak to it a little bit more. So I think shadowing is a great idea. And I think that actually at eatright.org, our professional organization, there is a search for find a dietitian. So you could, try to find a dietitian. You could Google, dietitians in the Bay Area. Even if you don't do a shadow, but you do an informational interview, just the more you can really learn about the profession to make sure that, it's something that you really want to commit to, the money and the time is really important. So, yeah, I would encourage you to do that.
Awesome. Thank you.
All right. Thank you so much, everyone, for attending. Thank you so much, Mikelle, for presenting, giving us so much great information. I definitely feel like I have learned a lot as well now I feel like I have more responses when students have questions for me about becoming a dietitian. So thank you so much, everyone. I hope you have a great rest of your day.
Yeah, thanks everybody. Thanks for being here. Bye.
Thank you.